If your patient is saying something about, I'm having hot flashes, and you immediately pick the obvious answer, the Nclex is probably tricking you and you're going to get it wrong. Because menopause is not about the symptoms. They're about what is happening hormonally. What is the red flag? The patient can say, I'm 51, I can't sleep, sweating at night, feel like I'm losing my mind. I'm not looking forward to that. Which finding is expected and when should you follow up? That's what the Nclex wants you to know. This is where people will either panic or they don't know how to answer the question. So let's go over patho. Menopause is when the ovaries stop producing hormones. There's a decrease in estrogen and a decrease in progesterone. And the brain tries to scream at the ovaries to work harder, throwing FSH at it, throwing LH at it. So those levels are going up. But that hormone drop affects everything. Temperature regulations, which is why you have your hot flashes. It affects the vaginal tissues. That's why they get dry. It's painful during sex. It affects their mood and their sleep. So that's why they have insomnia. Irritable. It affects the bones. So they're at a higher osteoporosis risk. It affects the heart health. So there's an increase in stroke risk. The Nclex isn't going to say all of that. They'll hide it under normal aging. The expected symptoms are all of those things that I just mentioned. But the Nclex is wanting you to know that one thing that is not expected. These are the Nclex red flags. These are the ones that are not normal that you need to call the provider immediately. There's bleeding after menopause. Having heavy bleeding, or they're bleeding in between their periods and it's worsening. Pelvic mass symptoms, they're bloated, there's a fullness, they have pain, or they have unexpected weight loss, or they're having chest pain and shortness of breath. Those are not normal. Postmenopausal could mean endometrial cancer until it is proven otherwise. That is what the Nclex wants you to know. The Nclex is going to want you to know your patient teaching. The best answer options are going to sound something like calcium, vitamin D, weight-bearing exercises. Those help to protect the bones. Smoking cessation will help decrease the hot flashes, decrease the stroke risk, decrease that bone loss. Tell them that they can use lubricants or moisturizers to help with any dryness. They need to layer their clothing or avoid triggers that can cause hot flashes, like caffeine or spicy foods or alcohol. Make sure they are getting their routine screenings, mammograms, pap smears, colon screenings. Wrong answers are going to be the answer options that say something about douching helps dryness. No. Hot flashes mean infection. No. Bleeding is normal after years of menopause. No. And if hormone therapy pops up on the Nclex, they want you to know that it helps the hot flashes and the vaginal symptoms, but it can increase the risk of clots and strokes and certain cancers depending on their history. The safest Nclex option is going to be the lowest dosage first for the shortest amount of time. Do their screenings for your contraindications. Do they have a history of clots? Do they have a history of cancer? That's what the Nclex wants you to pick up on. Menopause isn't scary, but the Nclex will make it dangerous when there's bleeding showing up. Know these little things for the Nclex and you will get these free easy points and pass. I hope this helps. If you want more information just like this, comment down Simply Nclex. I'll send you over all of the information about the topics that have been on the Nclex lately. Hope this helps. Tag a nursing buddy, comment down below. Let me know if you're testing soon. Like, save, share this out, and happy studying.